Hi, this is your Houston chiropractor, and we have Maria that came here
Hi.
all the way from New York City, Brooklyn, right?
Yes.
All right. So she was a little mad at me first when I told her the Astros beat the Yankees, but we've gotten over that now. But she's been suffering from severe hiatal hernia symptoms for quite some time, so bad that you've been on a baby food diet for how long now?
Oh, about 6-7 months.
6 or 7 months. Baby food, nothing but baby food. So we told her the very first visit when she got here, when we started working on her, to go out and eat anything and everything that she wanted all the time. And that's what we tell all of our patients, because we're testing the treatment along the way to make sure that it's functional and effective along the way. Now, she's still getting some ups and downs with her pressure under her sternum, which is what a lot of people feel with hiatal hernias, a pressure and a bloating and a pain right under the sternum and the rib cage, and we're still dealing with that at this point in time. So let's show them how we treat you, Maria. Let's have you flex your head forward and backwards here first. Let me check your posture. Okay, and then back to neutral. Yep, there you go. Now she's got a little bit of translation to the right on the x-axis, which makes her left shoulder a little bit higher. Her pelvis is translated just a tiny bit to the left of center, not too bad though. Heads forward and down just a little bit from the lateral aspect, so she's got the American condition, which is forward head posture, and that's usually from tech neck. That's working on the computers or texting, text neck. You probably heard of that.
Oh, yes, that's probably correct.
Yeah. Okay. Now, so first thing we're going to do is we're going to decompress her entire spine on the y-axis, which we do with every patient that has this condition. Let's go ahead and lay you on your back. Oh, let me take your glasses for you, Maria, and that way we won't bend your frame. Here we go. We have a lot of New Yorkers moving to Houston now. There's like 2,000 people a week moving into Houston right now. Yeah. It's like the fastest growing city in the U.S. Supposed to surpass Chicago as the third largest city within the next decade. So it's busy. We never run out of things to do we, Renee?
No.
Okay, good. Now, let's get this under your skull. And have you keep your teeth together. Take a breath through your nose. And let it all relax. Just like that. You feel it all the way down, Maria?
Oh, I did, yes.
Okay, good. Now, Maria, because the acid has gone always up into her throat and stuff too, she gets a lot of dryness and dry mouth and dry throat and kind of a raspiness and cough. And some sinus drainage as a result of that as well. Perfect. Yes, good job. You're relaxing really good for the adjustments. It's easier to relax now that you know I'm not going to tear your head off, huh? I don't have any heads on my trophy wall yet. I won't start with yours. Yeah, first time a little scary, huh? Okay, let's come over here, especially the decompression part, huh?
On my back or?
No, on your tummy first. There you go. So we want to make sure that her entire spine and pelvis is lined up, and you can see her right leg's about 1/4 of an inch short, and it gets even when I bring it up. Now that tightens up a little bit in your little back right there, doesn't it? Your thighs as well. Yeah, so she has a positive Knockless test and Deerfield on the right. So we're going to adjust her right SI joint first. And you notice I adjust that in a 45-degree angle, which is exactly the way the sacroiliac joint aligns in the pelvis. You have the right ilium, which is the big pelvic bone, then the middle triangular sacrum, and then the left ilium, so therefore sacroiliac joint. This is where a lot of people get their leg pain or sciatica from as well. L5, there's L4, L3, L2, all the way up into L1. And then I'm going to put your head down just a little bit here, Maria. Now this part right here is the lower thoracics And this is where the diaphragm attaches to the lower rib cage, which is cartilaginous in nature too. There's a mid-thoracics there, upper thoracics, and just exhale. There you go. Perfect. We may have one more little one right there. Yep, knew it was there. Good job. So we're not going to pull the turbinator out on her. She's got thin muscles in here. We're not going to hit her bones. We've used the turbinator about 10 times already this afternoon, and probably that many times this morning as well. And usually women can handle it better than most of our big jock men. I think women can handle pain overall generally better than most men, don't you?
I do.
Yeah, I know you do. You see it all the time, too. So do I. I know I get the old white knuckle syndrome and start moving around dancing when I get the turbinator done on me.
That's actually not bad. It helps.
Well, this isn't. This is my industrial gauge vibrator, but if I get that turbinator out, that's a lot deeper. You haven't had that yet. That's this big Black & Decker system. That sounds a little meaner, doesn't it? Now legs are even, and I bet you this is less tight this time. Yep. Good. Okay, let's turn you on your back now, Maria. So this is the important part of pulling the stomach down through the diaphragm. Now, when we first checked her rib cage, her right rib cage was a little bit lower than her left. You see how that's evening out now? See how my fingers and thumbs are pretty even now? Where this one was way lower at first. So let's come over here. Derek's come with her, and we always advise people that are coming from out of state or out of the country to bring someone with them that's in their family that can help pull their stomachs back down through the diaphragm. So we've been showing Derek how to do that. Let's go ahead and we're going to use these 3 fingers. We're going to go down below her sternum into the soft spot right there.
Slightly to the right.
Yes, a little bit to the right so we stay off the liver and the gallbladder.
Right.
And then put kind of your pisiform right there. Now I'm going to help you with the pressure here. We're going to go take a deep breath for us now, Maria. And exhale and keep exhale straight down, and then grab that stomach and pull it straight down. Yeah, you don't want to slide on the skin.
Yeah, this time I didn't feel it. Last time I felt it.
Now take another deep one. Let it all the way out. So I'm going to do this one, and right there it is. Now you notice how deep I'm pulling that, Maria? Do you see the difference? Okay, now I'm going to have Derek do it by himself and see how it feels comparatively.
The way I did it wasn't as
what you want to do is
right?
just go down deeper. Did it
My
feel like
finger-
he needs to go deeper than I did? Or I mean deeper than he did the first time?
You do it deeper.
Does he need to do it deeper though to
I
get
think
your
so,
stomach?
yeah.
Okay.
Well, my fingers hurt from that. But
Yeah, it takes some strong
Yeah.
fingers. This is not easy work.
this is pretty much the location. Right?
Yes,
This
sir.
is the right spot.
That's correct. Now you want to get this part of your hand is stronger.
Okay.
There you go.
Okay.
And then you go straight down in there first. Then breath
you
in
ready?
and exhale.
Exhale.
Yeah, did you feel grabbing anything there that time? Was that a little better that
You
time?
got it.
It was better
I
that
didn't
time.
feel it.
Did you feel a little more?
Not really.
Not as much?
Last
Yeah.
time I did it with you, I felt actually the hard
Yeah.
lump
Yeah,
in
most of the time you'll feel the fundus, which is the top round portion of the stomach, that feels fairly hard. A lot of times it's the consistency of a softball or a baseball once you get on top of it, like right there, and then pull it straight down, like right there, and now it's down. Much better. That was the best one yet. Good job. Okay, let's sit you up, face towards your knee there. Okay, now we're going to check her shoulders and elbows and wrists just to make sure she's completely lined up. But it's very important to continue this when you leave and go back to your home, because you're going to sleep wrong, or you're going to sit wrong, or you're going to be working on the computer all day, or you're text-necking all day, and you're going to have these things crop back up. So it's good to have a chiropractor where you live adjusting you. And you do have that, right?
Yes, we do.
And then we showed Derek how to pull her stomach down because a lot of chiropractors don't do that for some reason. I'm not quite sure why, but that's why we have so many people flying here to see us from out of the country and out of the state. Which are real close to the airport, right? Well, it only took you about 15 minutes to get here probably from the airport.
Yes.
Huh?
Yeah, those.
Yeah. There we go. Good. Okay, so Maria, would you mind sharing with our YouTube subscribers what brought you here in the first place to come down to Houston, and how has this done for you? This is your 4th treatment.
Yes, well, I guess desperation brought me here.
Frustration?
And
Yeah.
desperation.
Last resort,
yes,
desperation?
absolutely, absolutely. I was hoping that I would be able to avoid surgery and have this corrected and go back to having
Living
normal
your life, huh?
Yes.
Yeah, good. And do you feel like you're at least making a little headway that direction?
I think we do. I
Yeah.
think we do. I think it's important to do the exercises.
Yes.
And I think it's important to follow up and keep all those necessary adjustments that will have to be done in the future. But I think we are on the right road.
Yes, I think we're on the right track. Because you're not having to eat baby food now all the time.
No, I ate some regular food, although it gave me some trouble, but I hope that it will.
We'll continue
Yeah.
working through that through the week. She's got 4 more treatments, so
Yes.
we'll make sure and video her last treatment so she can tell you how she's doing on her 8th visit. This is your Houston chiropractor, and Marie, we still got to shoot her, so let's come over here in front of the mirror, Marie. You can't fly all the way down here from New York without me shooting you.
Welcome to Houston.
Yeah, welcome to Houston. Okay, let's flex your head forward and backwards. Of course, New York has their fair share of the shoots, too. There we go. Now, let's bring that all the way there. Perfect. Yeah. Okay, good. Now, let's try that same thing one more time, please.
Okay.
Now, that should have felt smoother and glides better that time, did it? Yep. Back to neutral. Yep. See, your shoulders are level now, and your head's right in the center. Oops, I'm sorry, I didn't mean to pull your hair. And your arms are equal distance from the side, and your hands are at your sides as opposed to being out in front of you. So that's good posture right now.
Okay.
So if you hold it, can you breathe a little easier right now?
I can breathe much easier.
Okay.
After
Without as much
every time,
pressure
yeah.
on that. Yeah.
Mhm.
Okay, so this is your Houston chiropractor, Dr. Gregory Johnson at Advanced Chiropractic Relief, which is our new YouTube channel, by the way, and Maria from New York City, and we'll see you next time.